Narcan can save a life. What you need to know about opioids and addiction. Opioid addiction is a national health problem. It affects people of all races, cultures, and ages. Use has increased by 400% since 1999. Overdoses have tripled since 2010. What you need to know about opioids, the drug. Opioids are depressants. They reduce consciousness and decrease the drive to breathe. Opioid used via intravenous injections and smoking deliver drugs to the brain faster, thus creating a higher risk for overdose than swallowing, snorting, or intramuscular injection. Daily or intermittent use of opioids builds tolerance, which increases the amount of drug needed to get the same effect. Facts about opioid overdose. Overdose is when the body has more drug than it can handle. Opioid overdose is not rapid. It gradually slows breathing until breathing stops. Lack of oxygen is the greatest risk. A few days of abstinence from opioids reduces tolerance. Then, if the same amount of drug is used as before abstinence, overdose is more likely to occur. There is time to intervene. An overdose can take up to 3 hours to completion. How to recognize an overdose. Slow or no breathing. Bluish tinge in lips and fingers. Limp body. Pale face. Cold, clammy skin. Gurgling or snoring sounds. The difference between heart attack and opioid overdose are as follows. For a heart attack, you would use the AED. The person's pupils are normal. There is a rapid onset. The individual's heart stops. The person collapses suddenly, and there is a sudden loss of consciousness. They stop breathing, and there is no pulse. For an overdose, you would administer Narcan. The person's pupils are pinpoint and constricted. There is slow onset. Respirations gradually cease. Their body becomes limp and droopy. There is a slow loss of consciousness. There is slow, shallow, erratic, or no breathing. And the pulse is slow, erratic, not palpable, or no pulse. But administration of Narcan will not harm someone having a heart attack, so don't worry. What you need to know about Narcan. Narcan spray can save a life. It has been used in ambulances and emergency rooms for decades. Use of Narcan will not harm someone. It has been used safely for decades to reverse effects of overdose. It has no side effects. It is considered a completely safe drug. Anyone can be a responder if they have been trained. Narcan is a safe drug. You, as a Good Samaritan, will not be held responsible for any harm. Narcan is easy to administer. You will follow other protocols which will bring help to the overdose victim, including calling 911. Because an opioid overdose is not rapid or immediate, you have time to respond. How to administer Narcan and get assistance. Identify the overdose. Slow or no breathing. Bluish tinge to their lips and fingers. Body is limp. Their face is pale, cold, and clammy. They're making gurgling or snoring sounds. Yell his or her name.
Patty, Patty.
Shake their shoulders vigorously. Rub the sternum hard. If no response and unable to wake them, find Narcan at your site. Call 911.
I've identified a possible overdose and I'm administering Narcan.
Report the OD, and the person is unresponsive. Tell them you are administering Narcan nasal spray. To administer the Narcan nasal spray, lay the person on their back. Peel back package and remove the device. Hold the device with your thumb on the plunger and 2 fingers on the nozzle. Place and hold the tip of the nozzle in either nostril until your fingers touch the bottom of the patient's nose. Press the plunger firmly with thumb until entire dose is administered. If the person does not respond within 3 minutes, administer a second dose the same way. Place the person on their side in the rescue position. Stay with the person until EMTs arrive. After administration of Narcan, call your administrator on call. Write an incident report. Process with your program director. The program director will secure a new supply of Narcan at your site. Thank you for helping.